I don't know what life would look like without my anxiety. How about that?
How do you deal with anxiety in your everyday life?
I take 2 different types of medicine to deal with my anxiety.
How I handle it? Well, I don't take medication, so I use some cognitive therapies, I guess, some mindful practices.
Well, I've had it so long, I've learned to sort of talk myself out of it. Like, I try to focus on something or get busy or talk to somebody, kind of just refocus.
How do I deal with my anxiety? I take medication to deal with my anxiety. I take Prozac, so that's an SSRI. It produces serotonin in the brain, so it's an antidepressant, but I am prescribed it for anxiety. And it works pretty well, so that's how I mainly deal with my anxiety.
It's just an everyday thing that I live with. There's nothing in particular that causes it. I started getting it really bad when I was in the Army, and then it's even worse now that I'm out.
What causes your anxiety? Do you know what triggers you?
No, I don't. Sometimes it's loud social gatherings. I'm generally a fairly confident person, so I think my anxiety is triggered when I am in an uncomfortable situation.
Actually, no. I think maybe it may be like a chemical imbalance, maybe, or that's one of the mysteries to me, is that it can seem to be okay, you know, as the day goes on, and then all of a sudden it's like it hits you out of nowhere.
For the longest time, I feel like I didn't know what triggered it. Now that I feel like I've psychoanalyzed it, and I kind of feel like I know what triggers it. I mean, there's a reason. I do think some of it is hereditary in my family. But I also think social situations and kind of uncomfortable and awkward situations make me anxious. Situations where I'm not in control, or I know I'm not going to be able to be in control, make me anxious. If I don't know what's going to happen, that makes me anxious.
I think it's beneficial, but it needs to be paired with therapy, like behavioral health, instead of just throwing medicine at it. It needs to professional help.
I have been told by people that are near and dear to me that maybe I should look into it. And I have thought about it seriously, but at this late stage in my life, why would I want to change the mechanics of my being that seems to be functioning well enough?
I think used correctly, it's great, because anxiety can be crippling. And I think if you've been properly diagnosed,
Right.
correctly diagnosed, and your physician or your counselor or your person recommends, you know, the medication, and like we said, is taken correctly. And I think talking to professionals and really understanding as best you can also helps.
I do think medication can be helpful to people who live with pretty debilitating anxiety. For me, as a counselor, I probably wouldn't think of anxiety as the first thing to suggest that a client pursue. I think I would want to talk with them about how much of an impairment the anxiety is to their life. But medication can be such a lifesaver too. And I've known many people, friends, family members, and clients who just get such good relief from appropriate levels of medication.
I think medication is great. I have a biased opinion because I've been on medication for anxiety since I was 15, and I remember being prescribed medication, and I knew exactly when it started working. Yeah. So I'm pro medication if you use it correctly. I think it can really change your life. It really changed my life, and I'm very grateful that I didn't have to go through different trials of medications, that I didn't have any side effects of this medication. I know a lot of friends who take medications or have taken medications that made them sick, that they had pretty severe side effects from the medication, and they just went off of it, and it kind of gave them a bad outlook on medication for anxiety or depression. Pro medication, it really has changed my life personally.